intervention that we're going to talk about is a cortisone joint injection. So basically injecting corticosteroid into the knee joint. So corticosteroids are anti-inflammatory, and since the knee joint does not have a lot of blood supply, the corticosteroids are not absorbed in the body too much, thereby the corticosteroid stays in the knee and exerts its anti-inflammatory effects and thereby helps with the pain. So this treatment is comparably effective to physical therapy, but has a key advantage of providing immediate relief from pain that can last for up to 3 months. So however, there are procedural side effects such as bleeding, infection, and the chances of introducing infection in the knee joint. But the biggest concern is that, does this cortisone joint injection worsen knee arthritis? And I've covered in detail in a separate video, and the link is in the description box below. But in my opinion, getting these injections every 6 months to 1 year should be totally fine. So the next intervention that we're going to talk about is injecting hyaluronic acid, or also called as a rooster comb injections, or also called as a gel injection. So injecting lubricating gel into the knee joint can prevent friction and inflammation, and thereby helps in patients with arthritis. This can help reduce pain and improve mobility. So in terms of effectiveness, it really works for patients with mild to moderate knee osteoarthritis. But let us say if this patient has bone-on-bone knee osteoarthritis, it is unlikely to help, although I would not discourage my patients to try this intervention. So in terms of safety, it comes with the procedural risks such as the pain, bleeding, and the chance of introducing infection. But other than that, there is no systemic side effects, or there is no concern about worsening arthritis. There is some concern about a local reaction site, a foreign body reaction to the site, since you're putting a foreign body into the knee joint, and they usually present as a worsening of knee arthritis, such as like swelling and worsening pain. But usually they can be controlled by doing an anti-inflammatory medication. The cost is still a factor though. So let us say if it's not covered by insurance, this cost can run up to hundreds of dollars. So the next intervention that we're going to talk about is intra-articular Toradol injection. So it is the same injection which was given intramuscularly. Now we're giving it intra-articularly. So basically putting the medicine into the knee joint. There has not been much studies to determine its effectiveness, and I'm not personally considered in my patients so far. A recent study showed that Toradol can be used instead of the steroid and is just as effective. However, the side effects associated with the intramuscular Toradol are still a concern with the intra-articular Toradol injection. So the next intervention that we're going to discuss is platelet-rich plasma injection. So this involves taking whole blood from the patient and centrifuging it to get a concentrated plasma that is rich in platelets. This is then injected into the knee joint. We believe that the growth factors in platelets can help reduce inflammation and prevent arthritis progression. So if you're really interested in this intervention, I would highly recommend to watch my other videos on this particular topic, and I've included the link in the description box below. In terms of effectiveness, it is still questionable, but some of the studies actually show significant improvement of pain in patients with mild to moderate knee osteoarthritis. In patients with bone-on-bone osteoarthritis, it's still really questionable. In terms of safety, they do come with a procedural risk such as pain, bleeding, and the chance of introducing infection. But the concern about worsening knee arthritis is not there. The reason these interventions are becoming really popular is because of the potential to prevent arthritis progression. So in terms of price, they are not covered by insurance in USA, and they can potentially be anywhere between $700 to $2,000 and more than that, and not all clinics might do this.